Ladies and gentlemen, in general, alcoholism, which would be pretty much the topic of the subject, is defined as chronic drinking that interferes with one's personal, family, or professional life. While occasional drink is not likely to be harmful, it is important to recognize that alcohol is easily abused. Factors that are thought to foster alcoholism could be genetic predisposition, learned behavior, childhood experiences, and that could include abuse. Progression of the disease varies from one person to another. For some, it develops as soon as they begin to drink. In most people, however, it progresses very slowly from periodic social drinking to more frequent indulgence until finally the person is addicted. Some alcoholics are binge drinkers and can go weeks or even months without alcohol. But once they had a drink, they're unable to stop until they're incapacitated or pass out. Although these drinkers have difficulty maintaining sobriety, they're unlikely to suffer severe withdrawal symptoms when they attain. In other cases, abstinence of 12 to 24 hours will produce withdrawal symptoms, such as sweating, irritability, nausea, vomiting, and weakness. Some severe symptoms develop in 2 to 4 days and may include delirium tremens, DTs. That is a condition marked by fever and delirium. Effects of alcoholism. Here are some of the effects that happens. Normally, when chronic overuse of alcohol takes place, it happens to take a heavy psychological and physical toll. Alcoholics often do not appear to be intoxicated, but their ability to work and go without daily activities become increasingly impaired. They're very susceptible to depression, mood changes, and even violent behavior. The suicide rate is more than double than the general populations. Alcoholics tend to be heavy drinkers and heavy smokers and may misuse other drugs, such as tranquilizers, for example. On average, alcoholism shortens life expectancy not only from suicide, but also because it raises the risk of other life-threatening diseases, which can include cancer, the pancreas, liver, esophagus, etc. Women who drink heavily while pregnant may have a baby with fetal alcohol syndrome, a constellation of birth defects, including mental retardation. So this is where it is critical when it comes to avoiding alcoholism. Now, here are some of the nutritional facts that goes aboard, which can lead to malnutrition, not because of chronic drinkers tend to have poor diets, but also because they alter digestions and metabolism of most nutrients. Severe thiamine deficiency, which can be marked by muscle cramps and wasting, nausea, appetite loss, and that's extremely common, are deficiencies of folate, riboflavin, vitamin B6, and even selenium. Disturbance of vitamin A metabolism may result in night blindness because many alcoholics suffer deficiency of vitamin D, which metabolizes calcium. There are also risk of bone fractures and osteoporosis. Impaired liver and pancreas are a function of many faulty fat digestion. Since alcohol stimulates insulin production, glucose metabolism speeds up and can result in low blood sugar. In addition, alcoholics are often overweight due to the calories, the empty calories at that normally sneaks up in alcohol. Once an alcoholic stops drinking, the nutritional problems are tackled one by one. Supplements are prescribed to treat deficiencies. A diet addresses underlying problems. For example, an overweight person needs a diet that reverses those nutritional deficiencies without additional weight gain. If there's liver damage, protein intake, damage control, must be monitored to prevent further liver problems. Maintaining sobriety. This is one of the critical things that should take place. Abstinence is really the only real treatment for alcoholism, while difficult to achieve and maintain. However, withdrawal may require medical supervision and may stay in hospital or clinic setting. Afterwards, support groups are critical. These groups, such as Alcoholics Anonymous, are usually find them in the yellow pages. Certain groups and things of that nature. Now, one of the things that can help cure this, as well as obviously avoiding alcohol, the biggest thing, What are some things that you can consume? It's good to have good seafood, perhaps lean pork, enriched cereals and breads. The main thing is getting the proper amounts of thiamine. Dark green leafy vegetables, oranges, other fresh fruits, poultry, and enriched cereals for that folate. Definitely legumes, pasta, and other starchy foods for a proper, hint proper, complex, well-moving carbohydrates. Keeping the energy levels up. And definitely, but the main thing is with alcoholism, the last thing you want to do is die a slow death. The last thing you want to do is consume your own death, consume killing. Any baby should be on board for those who are, expecting or trying to expect one day. But the main thing is practicing sobriety. Want to refill you back into the proper place? Definitely. I'm not saying you shouldn't have alcohol at all, but leave the alcohol alone, especially for those who are containing or being in a place of alcoholism. Definitely don't want to kill ourselves. We definitely don't want to damage and put the wrong fluids in ourselves, just as if you were putting the wrong types of oil, wrong types of fluids in the wrong tank. Could be damaging, could be destroyed. Let's refill ourselves and be fixed to fire by leaving alcoholism alone. Thank you.